How do we measure quality care in a way that truly supports families? In this episode, I sit down with Ben Harder, the managing editor and chief of health analysis at US News and World Report, to explore the heart and science behind the 2026 Best Nursing Home Ratings. Together, we break down the updated methodology, what makes top performing communities and facilities stand out, and how can families use this insight to make confident, compassionate decisions, whether navigating short-term rehab or long-term care. This conversation will bring clarity to a system that often feels overwhelming, offering a grounded look at the data, transparency, and a thoughtful evaluation that can guide better care for the people that we love the most. And more than anything, we look at how the data, when done with integrity, can become a bridge between the care families hope for and the care that they actually receive. And most importantly, we ask a bigger question: how can data evaluate dignity and empower older adults and families at a time when they need it most? Here is my interview with Ben Harder. Hi, Ben. It's always wonderful when I can have someone from your team to come and share. I know it's a topic that we are all very interested in. It informs a lot of decisions. So, welcome. Thank you for joining me today.
My pleasure. Thank you for having me.
Absolutely. So, when we think about US news, we often see rankings and numbers, but behind the work, there are a lot of people with a deep sense of purpose. So, I would love to hear your personal why that's guided your work in shaping how families understand quality and making care choices.
My personal why, sort of a number of kind of converging things, but I'll tell you one aspect of it, which is that I have a relative who was born with a congenital heart defect.
Mm.
And this is many years ago, he's about my age. The hospital that he was treated at was not the best hospital for the type of complex, rare condition he had, and his outcome was not good. And it's my belief that had he been guided to a more suitable hospital, his outcome in his whole life and the life of his parents and his sister might have been quite different. And so those sorts of stories, which are not unique to me at all, I think really animate the purpose that I have in trying to make sure that consumers of all types, whether it's a family member, an adult child who's trying to guide a parent, or a parent who's trying to look after their own child, or anyone who's looking after their own health. I want everyone to have data to make data-informed decisions. Every decision is different. Every person has to weigh all of the different factors that are relevant to them, but at least knowing which providers, which nursing homes, which hospitals, which senior living communities are of high quality, based on the data that US News has been able to bring to bear on that question, provides one important lens through which they can help themselves make a more informed decision. And so that's really what gets me excited every morning when I wake up and come in. And I also am lucky to work with a bunch of really smart, really dedicated, very mission-driven people. And that is always exciting because we're tackling difficult problems. It's hard to parse complex data sets and make sense of them and boil them down to the essence of what a family or a patient needs to know. But I have really capable teammates who I get to work with every day on those questions, and that's exciting for me.
Oh, it is. I've met a few, and I have to say it's been really cool to see the team and just as you shared, taking really complex information and distilling it down for us to be able to digest it, feel informed, feel empowered to make better decisions. It really is so important. So I appreciate that. And to let listeners know, tell us a little bit about your role and the work that you do.
So I'm a healthcare journalist by background, so my title is managing editor. I'm also chief of healthcare analytics at US News and World Report, which means that I oversee the team that acquires and analyzes the data to produce our rankings and ratings. And so, today we're going to be talking primarily about our nursing home ratings. We also evaluate senior living communities, as you know, because you had a colleague of mine on to discuss that. We evaluate hospitals. We've actually been ranking hospitals since 1990. So we have over 3.5 decades of experience evaluating healthcare in the hospital setting. We also evaluate surgery centers and so on and so forth. All of this is to help patients and family members make more informed decisions. And so my role is really to oversee which data sets do we use, how do we use them, what is the methodology we use to evaluate each of the providers that offer a particular service, and how do we express those results on our website on usnews.com, which is free for the public to access, so that they can take advantage of that information and make more informed decisions.
So important. So share with us some background on the U.S. News ratings of skilled nursing facilities. What's the why behind deciding to evaluate nursing homes?
Yeah, so there are almost 15,000 nursing homes in America. So, most communities in the U.S. have one or more of these facilities, and they offer different types of services. But primarily, those break into two categories. One is long-term care, and that's kind of what we tend to think about when we think about nursing homes. It's, a mom can't live on her own anymore. Her cognitive decline is getting worse, or whatever. We need to find a facility that will take her. And so that long-term care is a critical piece of what nursing facilities provide. But some people don't realize that nursing facilities, the same physical buildings, also provide a very different service to a very different group of mostly adults, but sometimes children as well, who have just been hospitalized and have had their medical issues addressed, but are going to, require some rehabilitation care before they're really able to live on their own once again, or at least live at full capacity on their own. And so that, post-acute care, meaning after hospital care, is a really critical piece of what nursing facilities provide. And most nursing facilities provide both of those services, long-term care and the short-term rehabilitation care. And so our ratings actually address both of those, and we have different data points, different methodologies that we use to rate these skilled nursing facilities in both of those two different services.
Right. Do you happen to know the data or numbers on how many people are served in a nursing home?
Yeah, so our understanding is that about 1.3 million people in any given year are in a nursing home, and that could be that they're living there as a long-term care resident, or it could be that they are discharged there after hospitalization and then sent home. Sometimes they're discharged there after hospitalization, but they never really recover well enough to go home, and so they ultimately transition into long-term care in the same facility or in a different one. But broadly, that's a pretty large population in any given year. And of course, many people will move through a nursing facility at some point during their lives. So even if they're not among that 1.3 million this year, they may have been last year, or they may be next year.
Yeah, I had many years actually working in a long-term care community. So I was the director, I oversaw some different departments, and we were a CCRC. So we had 90 long-term care, 100 short-term rehab, post-acute care, along with memory care and assisted living and whatnot. And to see how many people were in and out of our doors during that time, specifically with the post-acute care, was remarkable, right? You're touching so many different families and older adults and even younger adults that needed that support. And it was, I would say, changing for me to see the therapy and the rehab services and what was possible when it's done well, right? It's definitely a beast in and of its own, of just the massive admissions and discharge and making sure that that runs smoothly. So this is kind of fun for me to talk about as I go back to my work at that time.
Yeah, and I mean, you mentioned CCRCs, or continuing
Mhm.
care retirement communities, and they often offer an even broader suite of services to usually aging adults, but ranging from independent living, where someone's basically on their own in an apartment with some super sort of oversight and some services, maybe meals provided in a dining hall, to assisted living and memory care, where someone may have very dependent needs on the caregivers who are coming through their apartment or their room. And as you noted, continuing care retirement communities are required to have essentially a skilled nursing facility on site or adjacent as well. It's part of the services they offer. And so if someone is hospitalized and then ready to try to reintegrate into that retirement community, they're going to most likely spend some time in the short-term rehabilitation unit within that CCRC. And so there's a whole life journey that can occur within these larger CCRCs, and certainly within SNFs too. There are these different patient populations, as you said, and we want to make sure that everyone is well served. So that's why we really focused on evaluating discrete services and discrete phases of care that patients and families need to make sure that they're finding a community, a facility that's the right one for them at that time for their loved one.
Right. You explained that so well. Yes. There are a whole team that supports what you do in the work and evaluation. There's an updated methodology for the 2026 Best Nursing Home Ratings. I'd love to hear about that process and what you would like people to know about it.
Sure. Yeah, I'll tell you a little bit about the methodology, and then I'll mention what's sort of new and a little different this year. So we use a range of quality measures that we obtain mostly from federal government data sets that are really accessible to most people, but you wouldn't know how to interpret those data. And so we've spent a lot of effort analyzing the data, determining which measures are most meaningful to families and patients, and making sure that we combine them in a really rigorous way to produce, what is sort of published on our website, which includes all of the detail on different measures as well as our sort of summary assessment of the skill of the nursing facility. There are several different pieces of that methodology, and I'll talk about each of them. One is outcomes. That's the most important thing to most families and patients, and honestly to most healthcare providers as well, which is, what happened to this patient? Did they require care that might have been prevented with better prevention or better management of their health conditions? Did they live the fullest life? Are they able to live the fullest life and recover if they're in a rehab situation, recover function that they may have lost during their hospitalization? And so we look at a number of different outcomes, and these range from sort of the functional abilities that they may require to things like hospitalizations or trips to the emergency department. Was this patient, did they have a complication that the nursing facility couldn't handle? And perhaps, if you see a pattern of those at a particular facility, that may be a sign that they're not really on top of things and taking care of their patients or residents as well as they could. And so we look at the rates of different outcomes, like patients needing to go to the hospital, patients having falls that result in injuries. It's often a sign that they really aren't being observed as closely as they could and looked after by staff. We look at things like medication use and which facilities are able to rely least on powerful medicines like antipsychotics that can have a really sort of stupefying effect on residents. They can be a crutch for facilities that are understaffed, but they have real risks and a real impact on the quality of life of residents who get those medicines and don't necessarily need them for medical purposes. And so we look at all of these different facets of sort of outcomes and also the process by which those facilities get those outcomes. How much are they leaning on medication rather than adequate staffing? How good are they at preventing problems that result in complaints being filed with regulators, which is a real strong sign of an issue. The other really important component of our methodology is staffing. And as anyone who's had any contact with nursing facilities knows, the staff make the difference. And it's not just how compassionate and engaged the staff are, but are there enough of them? If staff are in short supply, if a facility is understaffed, no one is going to get the amount of attention that they might need or want. So we look at a number of different staffing measures. For example, in our long-term care rating, we have 11 different measures of staffing, and those range from how many total staff are there over the course of a certain period of time per resident. But we also look at things like how many registered nurses, so the sort of the highest level of nursing, are directly caring for patients, as opposed to, say, in administrative roles, or maybe nurses, with a lower degree of training, like a licensed practical nurse or a certified nurse assistant. And so we're really looking at sort of the level of training and the amount of contact that those highly trained nurses have with the staff. We also look at differences between weekday staffing and weekend staffing. If a nursing facility has a shortage of nurses on the weekends, that can lead to problems because patients aren't getting the attention that they may need. They may end up having complications or just suffering from the indignities of not having someone on hand to help them when they need that. We look at physical therapy, which is particularly important in the short-term rehabilitation space. Are patients getting help with relearning to walk if they've lost that ability while they were hospitalized, and so on? So these are different. We also look at staffing turnover. If nurses are leaving and being replaced frequently, even if you've got an adequate count of nurses, you may not really have the experience and the institutional memory and the coordination of care, sort of that continuity that is so important for taking care of patients that are, lose relationships that nurses may have established with patients. So all of these different aspects of staffing factor into our ratings, and we're looking at and really the sort of the pattern of all these different staffing metrics across that nursing facility in order to extract from that the information that patients need, which is does this place have good staffing, or is it coming up short compared to other nursing facilities?
So important to look at that, and it does affect it so much. I've seen it. I have seen it. Yeah. Any other things you want to mention in regards to that?
Well, you asked about what's different, and so we actually did expand the portfolio of measures that we use this year.
Okay.
We are now using 17 different quality measures in our short stay rating, or that's the rehab rating, and then 17 measures with some overlap, but 17 measures for our long care rating as well. A number of the staffing measures are relevant in both those contexts, but some certain outcomes, for example, are really more relevant to one patient population or the other. So that's a pretty wide range of sort of facets of care that we're looking at, and so our rating is based on essentially the composite performance, the totality of how that nursing facility performed across each of those 17 measures in each of our ratings. And that ensures that we can pick up on nuances, like two facilities that have the same overall staffing, but one has fewer nurses on weekends, or maybe they have the same staffing on weekends too, but one has had a lot of problems with retention. They've had a lot of turnover, or one has fewer of these highly trained registered nurses and is more dependent on CNAs, which are critically important component of the workforce, but there are things that they're not trained to do, and if there aren't enough RNs on hand to guide them, that can result in worse care for patients as well. And so when you look at 17 different measures, and again, this is an expanded portfolio of measures that we're looking at this year, that you can really pick up on these nuances. And as a result, when we look at facilities that have done well in our ratings, we see that they're really excelling across most or all of these measures.
Yeah. Did anything drive the expanded quality measures?
Yeah, we made a somewhat technical but fundamental change in our methodology this year, moving from something called factor analysis, which is a really sort of rigorous statistical methodology, but it's very difficult for both patients and for medical professionals to kind of understand how that methodology produces a rating. And so we moved to a more straightforward methodology that assigns an explicit weight, 5% or 10% to each of the 17 measures in our methodology. To be honest, caregivers and patients don't tend to get into the technical details of our methodology, nor should they. I mean, that's why my team spends so much time thinking about this and doing rigorous analysis so that they don't have to. And they can look at our results and easily make sense of, okay, this nursing facility is high performing for long-term care, and that's what my dad needs. This looks like a good place for us. We're going to go visit. That's the sort of decision making that we hope patients and families can make, because we've done all the hard work for them. But medical professionals, the owners and operators of nursing facilities, hospital leaders who are thinking about, well, which nursing facilities are our patients getting discharged to when we're done taking care of their medical needs. All of these medical professionals want to make sure that they understand the methodology and the results that we published as well. And so transitioning methodology to a weight-based approach makes it easier for them to understand and follow along. But it also opened up the opportunity for us to really incorporate more measures into the methodology. The factor analysis approach we had been using tends to function best when it has between 5 and 10 measures in a particular rating, whereas we can expand that, as we did, to 17 with each of our ratings this year. And so I think that also enhances the sort of our ability to capture nuance and reflect that in the results.
Yeah, so important. And there are other directories and review sites out there. What makes US News Rating different from the other ones?
Yeah, there are a number of directories you can find online for all types of aging services. I think what's distinctive about US News in relation to most of them is that we evaluate every facility that we have data for, and we evaluate it based on an objective, documented methodology. We publish a technical paper that describes exactly how we calculated the ratings. So there's no opportunity for someone for some nursing facility operator that wants to appear first on our results page to somehow influence the ratings. And I think with some of the websites out there that purport to sort of help you find a facility that's right for you, they may be putting their finger on the scale to make sure that their sponsors or advertisers come up first, the facilities that they have commercial relationships with. And as a journalistic organization, it's in our DNA at US News and World Report not to do that. We have a business side that sells ads and looks to make money and keep the lights on, but their work is entirely independent of the work that my team does, which is looking at the data, looking at the research, talking to experts, and deciding what is the right way to analyze the data and produce a rating that's useful to families. And the chips fall where they may, right? And so I think it's a really important distinction about how we approach evaluating nursing facilities and every other service, hospitals and senior living communities and so on. And that's, I can't say that there are no other operators, publishers out there that do that, but you have to really look at the fine print and know that you can trust what they're doing. And US News, just as a matter of how we as an organization think and work, keeps any revenue considerations apart from the methodological decisions that we make. There is one other publisher of nursing home ratings that I know to be free of commercial influence as well, which is the federal government. So the Centers for Medicare and Medicaid Services, which is a part of the Department of Health and Human Services, publishes star ratings for nursing homes. And to be completely candid, we actually source much of our data from CMS. So we're using the same raw data that the government itself uses to produce its ratings, but our methodology is quite different, and I think really informed by what experts in senior care have learned through research and analysis that they've done, as well as informed by our own analysis of the data. And so while our results for a particular facility may agree with the federal government's ratings, there are instances where it doesn't. And when I look at the reasons for those discrepancies, I feel really good about our methodology. And I'm glad that patients tend to find usnews.com more easily than they find, cms.gov whatever.gov,
Deep
which
dive,
I don't even
yeah.
remember the website where,
Yeah.
where the nursing home rates. You can find it by Googling it, I'm sure. But
Oh, yeah, and it is more complex to sift through,
yeah.
right? Yeah, I think the transparency is so important, similar but different with the podcast. I don't ever have a payment structure. There is no guest that has paid to be on. I find that I wanted the integrity of my interviews to be coming from a place of information and value and not just because someone paid to have an interview, right? So
It's so
similar
important.
but different, but
Yeah.
yeah, I wanted the ability to do that. I think that's really important. What about this year stands out, right? The best nursing homes. What are some of those themes that you have noticed that are among the best rated skilled nursing communities?
Yeah, I'm going to look at some notes here if you don't mind, because the
Yeah.
statistics that my team has generated aren't etched in my brain yet. But one of the things is, so we evaluate, as I mentioned, almost 15,000 nursing homes. Um, Fewer than, I mean, there's only 2,000 or so that have earned a high performing recognition from us, or are designated a best nursing home. Um, when we look at that group of facilities, these high performing best facilities, we find that on average they provide 20% more staffing per resident than the national average. And so if you look at that whole, 15,000 nursing homes, and you compare that to just this subset that US News has designated best nursing homes, you've got 20% richer staffing in those best communities. And that means the difference between, someone waiting 30 minutes after they ring the call button because they need help getting to the bathroom to, maybe waiting 10 minutes or 15 minutes. And so, having an extra CNA or an extra nurse on hand who can quickly attend to a resident's needs, or can be there, to help them get from their bed to the bathroom and make sure that they don't fall on their way and maybe break a hip. That's a really important thing. It's an important quality of life thing. It's also really important for safety and for the medical outcomes that patients experience. That one statistic alone, I think, was really striking to me. Another example of one of our findings was that in those top-rated skilled nursing facilities, we found that patients received 80% more physical therapy than they did in the national average. And
Wow.
so, that's almost twice as much, right? And so if you have been hospitalized, perhaps for a hip fracture, perhaps you had an infection, sepsis, a bloodstream infection, can be a really devastating condition. Someone may not be able to walk afterward because they've been on a ventilator in the hospital, bedbound for maybe weeks, and to have adequate time with a physical therapist who can retrain you to control your body and to do the things that you used to be able to do, but you may have lost during that prolonged hospitalization, has an enormous impact on the likelihood that someone is going to be able to go home and live independently again, their quality of life, their ability to, to avoid other, injuries or complications that would land them back in the hospital and perhaps even lead to a more rapid death. And so that availability of therapy to help people regain function that they've lost is a really critical thing. And 80% is a big difference. I mean, that is almost twice as much physical therapy in these best nursing facilities.
Wow.
One other stat I'll share, and I have a couple more if you're interested, is, we found that these top-rated nursing facilities had fewer hospitalizations among their long-term care residents. So, someone has been living sometimes for months, sometimes for several years in a long-term care setting, and those who were in best nursing homes for long-term care had 15% fewer hospitalizations per unit of time. So if someone spent if mom spends a year in a nursing home, the chance that she's going to need to be hospitalized during that time is significantly lower if she's in one of the best nursing homes, that we've identified through our analysis of the data. And that's obviously, no one wants to see the ambulance outside, outside the facility taking your loved one to the hospital. So that's a pretty important difference in outcomes, which we really think is important.
Mm.
And then, and similarly, when patients are discharged from the hospital and are receiving rehab in a nursing facility, there's always a concern that some complication could require them to need to go back to the hospital during that, hopefully short interval, sometimes a couple of weeks, sometimes a little bit longer, when they're getting this rehab and they're kind of relearning to be able to live independently. And we found that among the best nursing homes, there were 33% fewer emergency room visits during that rehab stay
Wow.
than we saw across all facilities nationally. So once you get your loved one out of the hospital, you don't want to see them have to come back. And there's a lot that's behind that statistic, a lot of differences in the amount of attention and the way that care is delivered to those patients. But it's a big difference.
Those are so fascinating and just gives you a glimpse into what sets high performing against the others, and such an important factor and truly will affect life, right? In a lot of different ways. Yeah.
It does. It does. On a personal note, I have a family member who was recently hospitalized, acquired a brain procedure, an emergency basis, got hospitalized in the middle of the night, and spent several weeks in the hospital, and afterward required rehab care. And the attention that she got from the physical therapists in particular, and occupational therapists and speech language pathology, has had a material impact. We can see day by day, week by week, while she was in rehab, how much progress she was making because of the attention and support that she got from these trained professionals. If your loved one is in that position, if you yourself are in that position, you want to make sure that you're at a facility that's going to enhance your recovery as much as possible.
Yeah, absolutely. And how should patients and families use these ratings? We can see, right? These ratings support people that need care, and what that looks like. How can we take that and then inform decisions?
Yeah, so we try to make it as easy as possible for your listeners and others to take advantage of the findings that we have, but also to give them all the rich data if they want to dive down into it. So I think the place for them to start is usnews.com. That's our public website. All of the content that we published about nursing homes and other healthcare providers is free. And on that site, they can, in fact, they can go to usnews.com/nursing homes to get to our search feature for nursing facilities. That they can look for one by name if they've been had one recommended, or they can look for options by geography, during a zip code or a city and state, and identify which nursing facilities we've evaluated. It may be maybe a dozen or more, depending on where they live, and which ones among those have been rated high performing. And importantly, depending on their loved one's needs, whether that nursing facility that they might be considering has been rated high performing in the service that they need, whether that's short-term rehab after hospitalization or long-term care, where they may be looking at months to years in that facility. And then on the profile that we publish for that nursing home, and again, we've evaluated almost 15,000 nursing facilities across the country. So we have a profile of every single one with the quality metrics that I've talked about, and more, and they can understand, okay, how did this facility's emergency room, rate compare to other facilities rate? How many hospitalizations were there per 1,000 patient days? 1,000, patient spends 1,000 days in the nursing facility. What's their odds of being sent to the hospital at some point because of some problem that emerges? And how does that compare to the national average? What is the staffing like for all of these different staffing measures? So they can look at all of that and see the benchmark against which we're comparing that nursing facility. And then we also have additional information on the profiles of these nursing facilities, some of which has not been used in our methodology per se, but it is important information for families to consider depending on their circumstances. So, for example, we indicate if a nursing facility has an Alzheimer's center or dementia unit, and For some patients, that's not relevant, but for some families, that's critically relevant. And so we have that. We mentioned you mentioned CCRCs in your past professional experience earlier. We indicate whether the nursing facility is part of a CCRC, and we also have ratings of the independent and assisted living and memory care units of those CCRCs, if it is. Those are just some examples of the information that we publish. But the idea is to give families, as they are trying to make data-driven decisions, all of the information at their fingertips, but starting with that rating that we've produced by summing all of the information we have together.
Yeah, so incredibly helpful. You had mentioned previously in our conversation about the new ranking or rating of home health agencies. And how does this relate to the work your team does around SNFs and other sites of care, right? Hospitals. How will these ratings also help navigate care?
I'm so glad you asked. Thank you. Our Best Home Health, our newest project, and one that we are working on right now. And so you and your listeners can look for that in the early part of 2026. We will publish our first edition of Best Home Health. And I think broadly, healthcare is a continuum, right? There are all these different services that when someone develops a medical condition, has a need, there's a whole ecosystem of healthcare providers that may be able to meet that need, but so much is dependent on the specific needs of that individual and their social circumstances. Are they married? Do they have family near them? Who is available? Do they have the resources to hire a home aide to look after them, to cook meals for them if they're not entirely independent, but they want to age in place? All of these things are factors that every family, every individual needs to navigate their way. And so our goal is to have as much objective, data-driven information at their fingertips as possible. Obviously, we started 3.5 decades ago with our hospital rankings. When someone needs to be hospitalized, that's a really important decision. It's a really it's a big deal, but it's by no means their only contact with the healthcare system. And increasingly, many needs are being met in these post-acute care settings like nursing facilities, or even in the home where there may be outpatient rehab that's available to patients. And so our goal in expanding our sort of methodology for the nursing home ratings and expanding into Best Home Health and looking at other care settings, our best ambulatory surgery center ratings are just a couple of years old at this point. We've been expanding our offerings in order to help patients and families find the information they need to take their next step in that healthcare journey. And these are not fun journeys for most families. I mean, there's a lot of challenge and suffering and stress associated with these. And if we can make it even marginally easier for families to make a decision they feel confident in, that they feel they have the information they need to figure out what their next step is, we'll be proud of that. So evaluating home health agencies is part of that, because they are an increasingly important piece of what many patients find as services available to them after they've had a hospitalization.
Just a curious question. Is the data harder to capture given care is taking place in the home, or are you still able to find some concrete data points?
Yeah, that's a great question. It in some ways it is. I mean, that's one reason we started with hospitals was these are high stakes situations, and it's really glaring in the data when one hospital has a great mortality rate, a low mortality rate for despite treating very sick patients, and another does not. And as we've expanded from that original mission, again, 3.5 decades ago, evaluating hospital care to other settings of care, we've encountered different challenges around, okay, what is important to measure? What are we able to measure with the data that's, that is produced. We're not going and interviewing every patient after their care, but we do have different sources of information. Much of it, honestly, in some way supported by the federal government. There are data sets that the federal government captures, often because a provider is making taxpayers pay for the care. Medicare is a taxpayer-funded program, and so every time Medicare pays for a service, there is a bill generated, and that bill has lots of information about the patient who received the service, the provider who rendered the service, what the condition of the patient was, what happened, what care was provided, and what the outcomes were. And so we're able to look at all of these essentially receipts and stitch them together and understand what happened to this patient over time, and who is sort of responsible for having pushed them in the positive direction, or let them slip through in a negative direction. But each of those evaluations has different kinds of challenges. So with our home health ratings, there is, thankfully, government data that we will be able to bring to bear. There's also patient experience information. There is a national survey that is required by the government, and does provide some comparable information, so you can make an apples-to-apples comparison between different home health agencies. Interestingly, that's something that we also have in hospital care, but is not available for skilled nursing facilities. That patient experience piece is not, so is a missing piece for post-acute care and for long-term care in nursing homes. And I hope that will be filled at some point. But we work with the data that's available to us from potentially many different sources, but we ultimately have to be able to make apples-to-apples comparisons in order to identify which providers, whether it's a home health agency or a skilled nursing facility or a hospital, how they compare to others.
Right. Do you ever have providers that reach out to you and share feedback about the ratings or how they're interpreted? I know hearing you share about the data and how it's pulled, I see the transparency and the fairness. Do you feel that is also acknowledged by the providers and families and whatnot?
Yeah, absolutely. That's a really insightful question. Yes, we get plenty of feedback and engagement, but we always want more because to the extent that U.S. News has been successful in evaluating all these different types of healthcare, it's largely because we have had a very engaged professional audience. That even though what we publish is designed for families and patients, healthcare providers, healthcare systems care a great deal about it because they know we've done a really rigorous job of evaluating the data. But every data set has its challenges, its imperfections, its nuances. And so we get a lot of input from healthcare leaders about, sometimes it can be little more than lobbying in service of something that they think will advantage them. But in other cases, it's really thoughtful and important insight that we gain into the nuances of delivering care for a particular population or in a particular geographical setting. And so that sort of feedback that we have with healthcare professionals has been really important for us in honing our methodologies over time. We're never satisfied with what we have. We're always looking to make refinements and to make it more useful to the public. And that give and take with healthcare professionals has been a really important piece of that. There's a study published in the New England Journal of Medicine a few years ago that compared, this was for hospitals, not for nursing homes or home health, but it compared several different rating systems of hospitals, including the one that the federal government publishes and U.S. News. And one of the things that I remember the researchers sort of highlighted about the U.S. News methodology is, or the U.S. News as a publisher, is how receptive we have been to both feedback from healthcare professionals and developments in the research literature, in studies that have illuminated nuances and in the data and opportunities to, tell a more perfect story about quality from the data that's available. And so we pride ourselves a lot on paying attention to what experts have uncovered about the data, and also listening with a very open mind to healthcare professionals who have a perspective on how we can use the data as to the maximum extent possible to provide actionable information for families.
Yeah, I appreciate that. That's really the ability to listen and learn and also share, right? It takes all of that. This is a question that just came to me as you were talking. There are a lot of tech vendor partners now that are having their systems within, whether it's senior living or skilled nursing communities, and they're capturing a lot of data, right? Based on whether it's a care portal or sensors, monitors, AI integrations. Has that been a thought or consideration of gathering data in that way? I'm sure that would be complex because then what vendor partner would you pull from? What does that look like? I don't know. Any
Yeah,
thoughts about that?
you're thinking you're thinking on your feet very well there. Yeah, no, you're absolutely right. This is something we are tracking, and I think there are encouraging opportunities on the horizon. At the same time, if we, as U.S. News said, well, we're going to work with this one vendor,
Yeah,
suddenly their market share, everyone has to own them. But are they
right,
the best vendor, or is it just
right.
they're the ones who, we did a deal with? We don't
Yeah.
want to impair
Mm.
the ability for healthcare providers to make the right decision for them and their patient
Mm.
population by forcing some solution or even creating a situation where people, where professionals might feel induced to seek one solution as opposed to another. So, there are some situations really in hospital care where healthcare providers have already voted with their feet in the sense that they've all coalesced around a particular kind of clinical
Mm.
registry where all the heart surgeons essentially in the United States report some really you know really important data to
Mhm.
their professional registry, and they had already decided on that was the place, that was the repository that they all trusted and wanted to provide their data to. And so we've been able to leverage some of that data in our rating of heart surgery hospitals, for example.
Mm.
And so there are a number of examples like that where we've identified essentially a data vendor or data solutions provider that is already widely accepted in
Mhm.
a particular segment of the healthcare industry, and that data set we can then have the ability to make apples to apples comparisons among providers based on that data set as well as other data that we've brought into our analysis. So I think those are absolutely opportunities. But if it's a balkanized market with 20 different providers that have 5% market share each, we're not going to pick one and be a kingmaker from a business standpoint, because again, our
Yeah.
editorial decisions have to drive how we approach
Mm.
this. It's not who's a commercial partner of U.S. News. It's what's the information that families need to make an informed decision.
I can see that. Yeah. And this has been so interesting. I've loved the day. I've loved the information and the dialogue. And I think it speaks to when you were sharing personal story related to that of the intersection of taking data, having storytelling together, shift how we see quality care, how it's actually really played out. So I appreciate you taking the time and sharing
It's
with
my
us. I'm
pleasure.
looking forward to
Yeah.
getting the episode out.
Well, thank you very much for your interest in our work. I'm very privileged to work with a really, really smart team of very dedicated people, and so this work is. I have the pleasure of getting to talk about it, but they've really done the thinking and the data analytics that's gone into this result that we're publishing.
Oh, I appreciate that. And thanks for thinking on your feet with me too. I threw a couple of
Yeah, my
new
pleasure. No,
questions
it's a
at your
great,
way. So,
great conversation. I really enjoyed it.
oh, Good. Well, thank you again. I appreciate all the work that you do and your team does. Thank you for listening today. If you enjoyed our episode, please subscribe and give us 5 stars. In all honesty, we'd love to hear from you. Thank you so much for listening to our episode.